Patricia Thomas. I'm doing an IV push competency. First of all, I'm going to verify my physician's orders against my MAR. And what I'm looking for is the right time, the right rate, the right route, the right amount of medication, the medication that I'm giving, the patient's name, and any allergies that I might have. The patient might have, excuse me. I'm giving Lanoxin 0.2 milligrams IV push daily. Okay, and doing my calculation, I'm going to give 2 milliliters. So I'm going to my book to check to see if that's a safe dose. And it says it can give maintenance dose in adults and pediatric patients over 10 years of age can have 2.4 to 3.6 micrograms per kilogram per day, given once daily. And I'm giving 2 milliliters, so that is a safe dose. It is compatible with still water, normal saline, or D5W. It can be given undiluted, or each 1 milliliter can be diluted in 4 milliliters of still water, normal saline, or D5W. Each single dose can be given over a minimum of 5 minutes. And I'm going to monitor for signs and symptoms of DIGE toxicity, which includes nausea, vomiting, vision changes, and cardiac arrhythmias. I'm going to monitor the renal function. I'm going to monitor the heart rate and blood pressure. But before I give this medication, I will check an apical pulse over for 1 minute. And if it's less than 60, I will not give it. Okay. And it is compatible, I said, with D5W, sterile water, and normal saline. So, I'm going to wash my hands and gather up my equipment. I'm going to verify my medicine against my MAR. I have Lanoxin here, and the expiration date is 4/20/21, and that is Lanoxin. And I'm going to give 2 milliliters. I'm going to label my syringe, and on my syringe I'm going to put the patient's name, the drug that I'm giving, the amount that I'm giving, and my initials. If the patient had an INT, I would take gloves to the room for the INT. So I'm going to the patient's room. My name is Patricia Thomas. I'm an RN. I'm here to give you some medication for this morning. The medication that I'm giving is Lanoxin, and it's for your heart. Okay, can you give me your name? Can you give me your date of birth? And do you have any allergies? Okay, and I'm verifying that also against my MAR. Okay. I'm gonna wash my hands again. I'm gonna be checking the placement on the IV line. Monitoring the site. See if it has any redness or swelling or anything on it. It does not. I'm gonna drop my IV bag down to see if I get a blood return. And I do. The patient has D5W hanging, and it is compatible with the medication that I'm giving. I'm gonna scrub my hub for 15 seconds. Discard my needle in the sharps container. Connect my syringe to the port. I'm gonna give 0.2 milliliters over 5 minutes, over a minute, for a total of 5 minutes. I'm gonna push and pause. I'm gonna push and pause. Making sure that the patient is tolerating the procedure okay, not having any puffiness or swelling at the IV site. Okay, I'm gonna push and pause. Checking on my patient, make sure the patient is doing okay whilst I'm with my medication. Push, pause. Okay, I'm gonna push. Disconnect my syringe from my IV port. Discard my syringe. Wash my hands. Making sure that the patient is doing okay, in a comfortable position, and instructing the patient to call if they have any nausea, any vomiting, or they have blurred vision. So I'm going to go out to the desk and I'm going to document the medication that I gave, the amount that I gave, the route that I gave, and how the patient tolerated. That ends my IV push competency.